Vaginal delivery or a cesarean section? What's the best way to have a baby? If you're curious about this question, then keep watching because today we're going to be discussing just that. Hi everyone, I'm Dr. Nabila Noor, board certified and fellowship trained urogynecologist and a pelvic reconstructive surgeon. Welcome back to the channel. If you're new and you like what you see, don't forget to subscribe and share it with a friend, especially with a loved one who may be pregnant or considering pregnancy. Or you know what, just share it with everybody because everybody at some point in their life are either thinking about pregnancy or know somebody who's thinking about pregnancy, and they will definitely thank you for sharing this information. So let's start with talking about the pros and cons of each mode of delivery. So vaginal delivery is what our bodies are naturally designed to do to have a baby. So what are some of the advantages of a vaginal delivery? There are many advantages, but we're going to talk about my top 3. Number 1 is faster recovery. So after a vaginal delivery, it's a much shorter hospital stay, and for most women, unless they've had a long labor or a complicated vaginal delivery or extensive lacerations or episiotomy, they recover pretty quickly and get back to your normal activities pretty immediately. And so you're bonding with your baby much quicker, you're getting back to your normal activities much quicker, all of which can be a great advantage. Number 2, avoiding surgical complications. Now, because a vaginal delivery does not require a major abdominal incision, you can avoid risks associated with the surgical procedure. Things like infection, bleeding, damage to surrounding areas, as well as recovery, as mentioned before, can be much faster. Number 3, once you have a successful vaginal delivery, your chances of having a successful vaginal delivery for your subsequent pregnancies are much higher. So what are some of the cons of having a vaginal delivery? Well, number 1 is that it can cause some serious damage to your pelvic floor muscles, as well as make you more susceptible to developing perineal or vaginal lacerations. A normal vaginal opening is about 3 to 4 centimeter wide. Now, for a baby's head to come through that vaginal opening, the vaginal opening has to stretch to almost 10 centimeter to be able to accommodate that baby's body and the head to come out. Now, oftentimes, because of that sudden stretch of the vaginal walls, it can tear, something we call laceration, or sometimes your OBGYN or your midwife may have to make an artificial cut to allow the baby's head to pass through, which is known as an episiotomy. Now, lacerations can range from a 1st degree to a 4th degree laceration, depending on how much damage was done to the perineal muscles, to the nerves, to the sphincter. Women can have long-standing side effects afterwards. Things like urinary incontinence, bowel incontinence, pain with intercourse, as well as they can have complications from these lacerations, things like a rectovaginal fistula, where there's a false connection formed between the rectum and the vagina, and as a result, women can notice that stool is coming out through their vagina. Similarly, if they end up with a vesicovaginal fistula, women may notice that there's urine coming out through the vagina, all of which can be really debilitating for a new mom. Number 2 is vaginal delivery is very unpredictable. It can take days. For some women, it can be 2, 3, even 4 days of labor before the baby comes out, and there's really no way to predict it. Of course, your first delivery is always the longest, and then subsequent deliveries are much faster. But as you can imagine, it can take a toll on the mom's body, especially if she has been laboring for a long time, and also when time comes to push the baby. Many times women are exhausted at the time of pushing, and a lot of the times your OBGYN or your midwife may have to use certain instruments to help aid the baby's delivery. Things like forceps or a vacuum to help enable the baby to come out quickly, maybe because the mom is exhausted and unable to push to get the baby out. And number 3, with a vaginal delivery, there are certain risks to the baby. Things like shoulder dystocia, which can be really scary and traumatizing, both for the patient as well as the physicians. So this is where the baby's head comes out, but the shoulder gets stuck. Of course, babies who may be larger in size or a woman who have a tight, narrow pelvis and having a large baby are at higher risks. And there are some risk factors that we take into consideration when deciding if a woman is at a higher risk for shoulder dystocia, but it's not always something that we can predict beforehand. A shoulder dystocia is basically an emergency where really the whole team has to come together to try to get the baby out as safely as possible without causing too much trauma and damage to the mom's pelvis and the pelvic floor. So now let's talk about a cesarean section. A cesarean section can be life-saving in case of an emergency, especially if there's concerns with the baby's heartbeat or the baby seems to be in distress, or in case of an emergency, especially things like any kind of placental abnormalities that can cause bleeding for the mom, things like placenta previa or a placental abruption. In situations like this, getting the baby out as quickly as possible is of utmost importance, and that's where a C-section can be a lifesaver. Also, there are certain instances where C-section is the only option for the mom. In case of women who may have underlying health conditions because of which the process of laboring may not be a safe option for them, as well as if you have a breech pregnancy where the baby's head, instead of being down below in the mom's pelvis, is actually on the opposite side under the mom's chest, and the legs are what's right in the pelvis. So in these situations, we actually consider a scheduled cesarean section to make it safe for both the mom as well as the baby to be delivered in a safe fashion. So what are the advantages of having a cesarean section? Number one is predictable. For most women who wants to schedule a cesarean section, you can do so after 39 weeks at a time that's convenient for you and your family members. Number two is avoiding vaginal lacerations. Of course, when you're having a cesarean section, you're getting the baby out through the abdomen, so the risk of vaginal lacerations is low. However, understand if somebody had a cesarean section after they've been pushing for a long time and failed to deliver vaginally, in those cases, there still may be some trauma that was caused from the laboring process prior to the cesarean section. And number three, it can be life-saving in case of an emergency, as mentioned before, especially under circumstances where the baby's heartbeat is not doing well, or the mom is having unexplained bleeding, or any kind of concerns that the surgeon may have. A cesarean section allows us to get the baby out as quickly as possible, as well as provide life-saving maneuvers for the mom. The cons of cesarean section are, number one, it is a major abdominal surgery where you're going to have a big incision in your abdomen, in the uterus, and that requires a much longer recovery than a vaginal delivery. Because it is a major abdominal surgery, so any kind of risks associated with a major abdominal surgery also applies to a cesarean section. Things like infection, damage to surrounding structures, bleeding, risk of blood clots. So women undergoing cesarean section are at a higher risk of developing this compared to a vaginal delivery. Increased risk of placental abnormalities, things like placenta previa, placenta creda, placenta percreta. So these are all complications, the risk of which increases with every subsequent C-section. There's also a small chance of some women developing something called uterine rupture, where the previous cesarean section scar opens up, causing excessive bleeding and can cause increased morbidity and mortality for the mother. So then the million-dollar question, what's the best way to have a baby? The truth is there's no one-size-fits-all because it depends on your health, your baby's health, and of course your preference. Now, ACOG, which is the American College of Obstetricians and Gynecologists, do suggest that a woman can have an elective cesarean section, but it should not be because of their fear for pain and not understanding the risks and benefits of each mode of delivery, which is why I went over in details about what are some of the factors that you should consider and talk to your OBGYN or your midwife about when deciding what mode of delivery may be the best option for you. Now, oftentimes patients or even family members ask me that what is your recommendation based on your experience and as a urogynecologist. And truth be told, a lot of it depends on what your idea of a family is. If you're somebody who wants a large family, then maybe considering an elective cesarean section is not the most ideal option because there are disadvantages to having a cesarean section, and with each subsequent pregnancies, you're at a higher risk for developing placental complications, bleeding, which can significantly affect your morbidity. But if you're somebody who, after weighing the pros and cons, who knows that you only want maybe one or two baby, and you've discussed the pros and cons of each mode of delivery with your physician, and you've thought about all the options, and then you want to consider an elective cesarean section, it is a conversation that you can have with your OBGYN. Make sure you're making an informed decision by weighing the pros and cons in details. No matter how you decide to bring the baby in this world, remember that you're doing an incredible job living through pregnancy. Delivering a baby is probably one of the hardest things that you'll do. So give yourself grace. And remember, there's no right way or wrong way of delivering a baby. It's a way that works for you and your family and your particular situation. Thank you for watching. Hope you found this video helpful. And if you did, like I mentioned, don't forget to share it with somebody who may be considering pregnancy or currently pregnant and going through some of these questions, because it will definitely shine some light in their thought process, and it will give them some good questions and thoughts that they can take to their care team to be able to come up with a decision that works best for them. And also, if you like contents like this, definitely put it in the comment section, and don't forget to subscribe to the channel as well as my monthly newsletter to get more helpful tips about your pelvis and how to take care of it. Talk to you soon. Bye.